Okay, guys, welcome back. We're going to get into the third portion of our skeletal system lecture today. So we're going to be talking about the major divisions of your skeleton, and then we're going to actually start getting into learning all the bones of the skeletal system today. So let's go ahead and get started. All right, so the two major divisions of your skeletal system are axial and appendicular. Right, so the axial skeleton is anything that's kind of on this main axis. So that's going to include the skull, the vertebrae, the rib cage, everything on this main axis is considered axial. The appendicular skeleton is the appendages, so your arms and your legs, and the girdles that kind of attach those to your body. So we're talking about appendicular, we're talking about the arms and then the shoulder girdle and the legs and the pelvic girdle, right? So that's what's attaching those parts of the skeleton to the main axial part of the skeleton. All right, so axial skeleton is going to include all the bones of the skull, the little tiny bones that are on the inside of your ear, so your ossicles, your hyoid bone, which is in your neck, we'll talk about where that is, includes all of your ribs, your sternum, which is the breastbone right here. I'll show you this guy right here. Can I get him in the picture? Sternum, which is right here, and then all the bones of the vertebrae, which are your backbone. Whereas the appendicular skeleton is everything else. So that's everything in the arms and the legs and in the shoulder girdle and the pelvic girdle. Okay, so in total, there are about 80 bones in your axial skeleton. So that's what we're going to be walking through in the next few minutes together here. We're going to talk about all 80 of those bones, and those are going to be what you're going to have to learn this week. So we should know the names of all of those and where they are by the time we're done with this. All right, so we're going to start with the skull. All right, so the skull obviously has some important jobs here, right? So the skull is going to be protecting the brain. It's protecting all of the areas where you house your special senses, so senses like vision and smell and taste. That's all kind of, and hearing, that's all in your skull. So, and there's little tiny holes in there, special structures to house all of those different parts of your nervous system. So we're going to kind of go through and talk about where those things are housed and what the names of the bones are that surround them. All right, so bones of the skull here. So we'll start by looking at I'm just going to take this off because that's going to be easier. So bones of the skull. So as we look at the skull here, Oriana, so it looks the same to you guys. So if we're looking at the skull here, we can divide the skull into being the bones of the face, so facial bones, and then cranial bones, which are the ones that are holding the cranium or the part of the brain case together. So cranial bones versus facial bones. All right, so the cranium itself, or the brain case, has 8 bones. All right, so we're going to go through these one by one, and I'll just kind of point them out on here, and you can see them labeled in your PowerPoint as well. So the brain case, or the cranium, has 8 bones. The first one is the frontal bone. So frontal bone right here. So that's basically your forehead bone. If we turn all the way around to the back, we can see the occipital bone. So now I've turned this skull all the way around to the back. Occipital is this kind of bone that's at the back and the base of the skull right here is occipital. Underneath here, it gets a little bit confusing. Let me try to focus in on the camera there. So underneath here, we've got a couple sort of odd-shaped bones that are going to be forming the base of the brain case and also kind of the base of your nasal cavity. So those bones are going to be the ethmoid and the sphenoid. It's not going to be super obvious to see them in here, but I'll show you on the next couple slides what those look like. And then if I rotate back so we can see kind of a normal view of the skull here on the side, we can see the temporal bones. So temporal bones are right here, right? So at your temples. And then the parietal bones are the ones on the top of the head. So if I look at the top of this guy's head, we had the frontal here and then paired parietal bones on either side of the top of his head. All right, so there's another view of those same bones. So we can see parietal on the side of the head, frontal where your forehead is, temporal also on the side but closer to where your ears are. Occipital is the back of the skull, and then on the front You can kind of see a little bit of those two weird shaped bones I was talking about, the sphenoid and the ethmoid. So sphenoid, let me set this skull down for a second. Sphenoid is going to be this guy right in here. So you can see him a little bit from the side here. We can also see a little bit of ethmoid from the side here, but we're going to get a better view of those once we start to kind of break the skull apart and see what's going on under the hood here. Okay, so all of these bones that you have in your skull are fused together, and wherever two bones come together, we consider that a joint. But the joints in your skull hopefully are immovable, right? So we don't want those joints to be moving around too much. So where we have an immovable joint where they're kind of seamed together, we refer to that as a suture, right? So you have a few major sutures in your skull. I'm not going to make you know all of them, but we should know some of them. So the first one here, the coronal suture. So that's a coronal suture that sutures this frontal bone to the parietal bones behind it. So it's kind of in the coronal plane, so that one should be kind of easy to remember. We also have a squamous suture here. So the squamous suture is the one that's kind of suturing your temporal bone to your parietal bone on the side of your head. And then a lambdoidal suture, and that one is going to be in the back. So that one is fusing your occipital bone to your parietal bones in the back of your head. Okay. When you're a tiny, tiny baby, those bones are not fused together yet, right? Because we have to leave room for your brain to get bigger, and your brain gets much, much bigger as you grow, right? So we all start off kind of like with big heads, but the heads get even bigger as we grow, which means that those bones, if they were fused together at birth, there wouldn't be any room for the brain to grow. So while the baby is still young, we have soft spots in the head, and those soft spots are called fontanelles. And fontanelles are just areas of connective tissue where the bones haven't fused together yet. So right here, you're looking at the skull of a baby. So you can see those little soft spots, the areas where the bones have not yet fused together, but they will as the baby gets older. Okay, so let's look at some of those kind of bones of the interior skull a little bit more closely. So I mentioned that you have a bone called the ethmoid bone, and that bone is going to be kind of up underneath the brain case in your nasal cavity, like forming the top of your nasal cavity. And then the sphenoid bone, which is also kind of up underneath your brain in your face. So here we can see both of these. So excuse me, this is the ethmoid bone here on this side, and then over here, this is the sphenoid bone. The ethmoid bone, just to kind of give you orientation of where we are in the body, you can sort of think of this being, if we were looking at your nose, this is terrible. If we were looking at your nose, it would be right around there. These are your nostrils, and your eyeballs would be up here, right? So that's kind of where we are. So it's sort of like behind your face, a little bit deeper up in the back of the nasal cavity. Same over here. So here for the sphenoid bone, this part of it right here, you see, let me draw some eyeballs. Your eyeballs would be right here in front of the bone here. So this would be kind of sitting behind where your eyeballs are in your skull. So if I bring this guy back over here and show you, kind of way back in the skull there, you'd be seeing these that parts of the sphenoid bone there. Right, so that's what we're looking at there. You'll notice when you're looking at these two bones, the pictures of them here anyway, that there's lots of little holes in them. It looks like these little open spaces there. Those are sinuses. So sinuses you have in a lot of these bones of the face. So you've got some sinuses in your frontal bone, you've got them in your ethmoid, sphenoid, and you've even got sinuses in your maxilla here. Those sinuses have a few different purposes. One of them is they make your bones lighter. So your facial bones would be really heavy if they were solid. So we need these little air spaces in the bone. Also, they help to resonate the sound of your voice. So as I'm producing sound down here in my larynx, that sound is vibrating through all the bones of my face. And those sinuses are helping to make that sound make sense, or make it louder, I should say. Right, and the other job of sinuses is to kind of help warm and moisturize the air that we breathe in. So you breathe in air through your nose or through your mouth, and then it's going right down into your lungs. But we don't want that air to be too cold or too dry when it hits the lungs. So just running it past all these mucous membranes that are built around these sinuses is an important part of warming up that air and moisturizing it as we take it in. Okay. All right, so in this picture, we can see some of those sinuses a little bit better. So we can see the frontal sinuses right up here. We can see those maxillary sinuses. So this, if you've ever had a sinus infection and you felt that kind of pressure here and the pressure here, it's because you've got an infection in those holes inside your skull. And yeah, that could be pretty painful once you start to get inflammation in those areas. All right, here's a side view of the skull, so where the skull's been kind of cut in half sagittally, so we can see a sagittal cut here. And in this sagittal cut, you can see right where that sphenoid bone is. So again, the sphenoid bone is kind of, it'll be back behind where your eyeballs are sitting, behind your nasal cavity, holding up the bottom of your brain. Okay, so those are the bones of the brain case itself. We also have facial bones, and the facial bones are going to be more concentrated, you know, here in your face. So we're going to go through these one at a time. One of the easy ones here is your mandible. So mandible is your jawbone, the lower jaw. Then you have two paired maxilla. So the maxilla would be the upper jaw. So we can see this one kind of in yellow right here. That's maxilla. And you have one on each side of your face. Vomer, we can't see from this view. Let me grab my skull again. So if we look at the skull here, let me get them lined up so you can see on the camera. This kind of perpendicular line that's inside of the nasal cavity, the lower portion of that line is the vomer. So vomer kind of separates the nasal cavity into two distinct sides. We also have nasal bones. So the nasal bones themselves are these guys up here. So kind of highlight that there. They're the ones that are kind of creating the bridge of your nose. So if I take off my glasses here, these guys are your nasal bones. You can feel those. They feel hard. As we move down into the rest of the nose, that's all cartilage, right? So the only bones are actually tiny ones up there towards the bridge of the nose where your glasses sit. We also have zygomatics. So zygomatics are here. Zygomatics are your cheekbones, right? So those are the ones that you feel way up here. Those are the, you know, if you have really high cheekbones or low cheekbones or however your cheekbones happen to be, those are your zygomatics. We also have lacrimal bones. Lacrimal bones, kind of show you here, they're not pointed out in this picture, but they would be right here. So kind of right on the inside of where your tear ducts are. That's where you're going to find lacrimal bones. So lacrimal, the term lacrimation means tears. And then palatine, we can't see those in this picture, nor can we see inferior nasal conchae. So we'll look at those in the next picture, hopefully. Yeah, so this one, looking at a frontal view of the skull, we can see more of these bones again. So right here, frontal bone, we can see those nasal bones here, right? So bridge of your nose. Right kind of next to those, a little bit lateral to those, are these two lacrimal bones. So there's one on that side and one on this side, and that's where your tear ducts would be. We can also see a little bit of that sphenoid. Remember the sphenoid, the odd-shaped bone at the back of the eye orbits is back there. From here, we can see a little bit of vomer. So remember I said vomer was kind of like a creating part of your nasal septum. The bottom part of the nasal septum is vomer. The top part of the nasal septum is part of your ethmoid bone. So the ethmoid, another one of those strange bones that's kind of up underneath your brain case, forming the roof of your nasal cavity. Now inside the nose here, so I'm going to have you kind of focus on the inside of the nose. There are some kind of layers of bone inside here, and I'm just going to outline a couple of them here. So those are middle nasal conchae and inferior nasal conchae. You actually have superior nasal conchae too, but they're not super visible in this kind of picture. The superior and the middle nasal conchae are actually part of the ethmoid bone, right? And so these are flaps of bone that in a living person are going to be covered with mucous membrane. It's going to be important for warming and moisturizing the air that comes in through your nose. The inferior nasal conchae, which again you have on either side, concha would be one, conchae is two. Those inferior nasal conchae are their own separate bone. So those count as a separate bone, whereas the superior and middle nasal conchae are part of the ethmoid bone. From this view, we can also see the zygomatics over here, so creating your little cheekbones on that side, the maxilla, which are on either side of the upper jaw, and then the mandible, which is this one movable bone down here at the base of the face. All right, and so looking at it from the side here, so another sagittal view where we've kind of cut a mid-sagittal line through the skull. So we can see, again, vomer. I like this view, so you can see what the shape of this bone is doing here. So the vomer creating the bottom part of the nasal septum. This large plate of bone up here is part of the ethmoid, so this would be considered perpendicular plate of the ethmoid bone. It's kind of cutting the nasal cavity in half. Inside here we can see inferior nasal concha. We can see the sphenoid sitting back here. And then down here we get into the maxilla. And then this one we haven't mentioned yet, palatine. So palatine is this tiny little bone that creates a part of the back of your upper palate. So let me show you this here. So if I'm looking at this guy, get him in front of the camera there. If I'm looking at this guy and I can see his upper palate, so the roof of his mouth here, the front part of this, the one that's closest to the teeth, that's going to be maxilla, but as we go a little bit further back, two tiny little bones back here are the palatine bones. Okay, so those palatine bones are the kind of posterior aspect of your hard palate, forming the roof of your mouth, right? And then at the bottom there is mandible, which is your lower jaw. Okay, so in addition to all of those bones of the skull, so we covered the bones of the brain case and we covered the bones of the face, you also have a little tiny bone, which I can kind of show you in this guy. Now I took his head off, but his head would be right here, obviously. And then he's got this little itty bitty bone that's kind of hanging underneath the jaw there. That's called the hyoid bone. So the hyoid bone is it's below your jaw, but above your voice box, above your larynx. It's the only bone in your body that doesn't articulate with any other bone. That means it doesn't touch any other bone. It's just connected to ligaments and to muscles that are kind of holding it in place. And so those are used for muscles that we use for swallowing and for speaking. All right, and then three more little tiny bones in your skull. So these are your ossicles. So I don't have pictures of the ossicles because they're very, very small, or I don't have a model of it because they're very, very small. But these would be inside the ear. So if we look at this guy here, and we were to go inside his ear, we would find three tiny little bones. Those are the malleus, the incus, and the stapes, and those bones are there to vibrate, to amplify sound so that we can hear. Okay, so made it through the first little part of this lecture, so I want you to think about some of the bones we've talked about, and where do you think the sphenoid bone is? Where do you think the occipital bone is? Where are the zygomatics? And where are the maxilla? All right, so thinking about that, hopefully. So if I bring up this guy again, let's look at where these bones are. So if I ask you where the sphenoid bone is, I'm going to show you a couple different views of it. So again, we can see part of it in the very, very back of the orbit here, in the back of the eye. And if we turn to the side here, you can see a little bit of sphenoid here, kind of behind the orbit again. So that's where the sphenoid is. If I ask you where the occipital is, we'd want to turn them all the way around, and we would say the occipital is this bone here at the base of the skull in the back. If we're asking about zygomatics, those are going to be these cheekbones here. So zygomatic here, zygomatic over there, little cheekbones. And then the maxilla, those are his upper jaw. So those are here. So the ones holding the teeth on the upper jaw. All right, so we're moving on to the vertebral column. So we covered all the bones in the head and the face, and now we're moving down to the vertebrae, which is your neck and your back. So your vertebrae, you have a lot of them. Each one of them kind of looks like this picture here, although they don't all look the same. So each one looks a little bit different. So the one that we're looking at here, let's note the major parts of it here. So we've got a vertebral body. So the body of the vertebrae is the kind of like the thickest part of the vertebrae. That's the part that's going to be weight bearing. So when you think about your vertebral column, your spine, that's carrying all the weight of your entire body. So we need that vertebral body to be really thick and really robust so that it can hold the weight of your body. All right, so that's the body of the vertebra. We've also got these pedicles, which are here and here, and then the lamina here. And then we've also got some processes. We've got a process out to this side, and again, a process is just like a projection of bone. So we got a process over here, and then a process back here. So the one in the back is the spinous process. So that's, turn this guy around so you can see his back. So we're looking at the back of the skeleton here in the lab. And the parts of the back of the skeleton here, if I turn it at kind of an angle so you can see a little bit, the parts in the back here are the spinous processes, and you can actually feel those in your own back. So if you kind of run your fingers down the back of your neck and down your back, you can feel those spinous processes. So those spinous processes here, they're basically for the large muscles of your back to have something to attach to. Right? Transverse processes like these ones that are going out to the side, those have a different job. We'll talk about what those do in a second. Okay, so in addition to those processes, we've also got some holes here. So we used the word foramen before, or foramina would be the plural of that. So a foramen is a hole, right? So if I'm looking at one of these vertebrae, we've got a vertebral foramen, and that's the hole that's in the middle of this vertebra. So you can guess as to what you think is going through there. So the answer is your spinal cord, right? So your spinal cord runs through the holes in those vertebrae, or the vertebral foramina. So in addition to that vertebral foramen that goes kind of straight through each vertebrae, if we articulate multiple vertebrae next to each other on top of one another, we start to build these intervertebral foramina. So intervertebral would be the foramen between the vertebrae. So intervertebral foramina those are basically openings for nerves to pass through. So the nerves that branch off your spinal cord have to have a place to get out and innervate the rest of your body. All right, so an overall look at your vertebral column here. So we can kind of break apart the vertebrae into different sections. So the first section of vertebrae, the ones that are in your neck, those are called your cervical vertebrae. So you have 7 cervical vertebrae, and they're just numbered C1, C2, C3, C4, C5, C6, C7. Then you've got 12 thoracic, and those are also numbered just T1 through T12. You've got 5 lumbar vertebrae, which is your lower back, so and those are L1 through L5. And then we've got 2 vertebral bones that are kind of at the base of the spine down here, and those are going to be your sacrum and your coccyx. These are both kind of triangular shaped bones that form the base of your spine. Okay, all right, so when I already mentioned the vertebral foramen and the intervertebral foramen, but here's a picture where you can see the actual spinal cord running through them. So with a bunch of vertebrae here stacked one on top of the other, we can see that those vertebral foramen leave space for the spinal cord to kind of run through here. So we can see the spinal cord coming through the center there. And also in these intervertebral foramen, there would be spaces here then for spinal nerves to branch off of the spinal cord and branch out of that enclosure and get into the rest of your body. Okay. Now, in between those vertebrae, it's not just bone on bone, and we've mentioned this before, how your spine itself is carrying a lot of weight, right? So the entire weight of your body is held on the spine. So between each one of these vertebrae, you actually have pads of fibrocartilage, right? So we've got these fibrocartilage pads, sometimes called intervertebral discs, and those intervertebral discs are thick pads of cartilage that are there to help support the spine and reduce the amount of pressure that's put on each bone, right? So it keeps you standing up. All right, so let's talk a little bit more about the differences between some of the vertebrae here. So your cervical vertebrae, which are the ones in your neck, so these cervical vertebrae, again, are numbered 1 through 7, but the first 2 cervical vertebrae have their own names because they kind of have special functions. So your first cervical vertebra, C1, is also called the atlas. Right? So atlas is another name for C1. And if anyone's familiar with old Greek mythology, Atlas was the guy that carried the whole world on his shoulders, right? And that's basically what your atlas does. So this bone up here, this C1 up here, atlas, is carrying your whole head, right? And the head is the world in this analogy, right? So the atlas is carrying the whole world on his shoulders. The second cervical vertebrae is called the axis. So the axis right down here. The axis has this process to it called a dens. I'm going to circle it for you here. The dens, also called the odontoid process because it looks like a little tooth sticking out of that bone. The axis is what allows your head to rotate side to side, right? So the head can basically, if this is the dens of that axis, the head can rotate around it, right? So axis is what your head rotates on, just like the earth rotates on its axis. So those are the special names that we give to the first and second cervical vertebrae. All right, and then the rest of the cervical vertebrae there. Something special to note about cervical vertebrae is, in addition to that, the main vertebral foramen, there are also transverse foramina. So you can see this one out here. There's a transverse foramen. Here's a transverse foramen. Only cervical vertebrae have those. So if you ever just find a vertebrae laying around and you want to know if it's cervical, thoracic, or lumbar, if it's got transverse foramen, then you know it's going to be cervical. Okay, so moving down to the thoracic. So we've got 12 thoracic vertebrae, not pairs, just 12 thoracic vertebrae. So those are numbered T1 through T12. These ones start getting a little bit bigger. So as we move from, so here's your first 7 here, the cervical. So that was 7. As we move down to the next 12 here of the thoracic, we're getting a little bit bigger, right? So these vertebrae, I'm going to write the number 12 here. These vertebrae are a little bit bigger. They have a thicker body to them, and they also have much, much longer spinous processes. So if we look at these spinous processes here, they stick way further out in the back than the cervical ones did, right? So longer spinous processes, bigger bodies in the thoracic vertebrae. Another thing we see here are these facets. So remember, a facet is like a smooth portion of a bone. So here's a facet here. The thoracic vertebrae, all 12 thoracic vertebrae have articular facets for the ribs. So if I look at this guy again, he's got ribs that are attaching to each of his thoracic vertebrae in the back. So every thoracic vertebra is going to have a pair of ribs attached to it. So next thoracic vertebra, next pair of ribs. Those ribs are attaching to those little articular facets on the side of each rib. Right? And just while I've got this picture up so we can remember, after we have the 12 thoracic vertebrae, we also then below that have 5 lumbar vertebrae. And the way that I used to remember this, and it might be helpful for you as well, is the vertebrae go 7 for cervical, 12 for thoracic, 5 for lumbar. You have breakfast at 7, lunch at 12, and dinner at 5. And so they just go in order of time through the day. So breakfast at 7, lunch at 12, dinner at 5 is how I remember how many of each type of vertebrae you have. Hopefully that's helpful to you. All right, so moving down into those lumbar vertebrae. So lumbar vertebrae are going to be bigger still. So now that we're getting way down into the lower back, these vertebrae are really carrying the weight of the entire body on top of them. So the bodies of each one of these vertebrae are bigger. The spinous processes get a little bit shorter, and we don't have facets for rib articulation here. So we don't have any ribs that articulate with lumbar vertebrae. Ribs only articulate with thoracic vertebra. Right? So these are bigger, a little bit stouter, and they're carrying a lot of the weight of the body on their shoulders. Okay, all right, down to the very bottom of the spine here. So way down here at the bottom is where we find the sacrum and the coccyx. So sacrum is this triangular shaped bone that forms the base of the spine. It's basically, it used to be separate bones. So your sacrum is actually five sacral vertebrae that have been fused all together into this one triangular shaped bone. So we can still see some of like these intervertebral foramina here, even though it's basically all fused into one bone at this point. All right, and then just below that sacrum, we've got your coccyx. Coccyx is the tailbone, so that's another little tiny triangular shaped bone. This one much smaller, that kind of is attached to the base of the sacrum. It's also made of several fused vertebrae, so you had about between 4 and 5 coccygeal vertebrae that fuse together in utero to form this one tiny little coccyx, which is your little tailbone. All right, so here we are with the whole spine again. So just to review, 7 cervical vertebrae, 12 thoracic, 5 lumbar. The shape of them gets a little bit different as we go down. So cervical vertebrae tend to be the smallest. They have transverse foramina, and they are not carrying too much weight. The first one is the atlas, the second one is the axis, and that helps support your head and allow for head movement side to side. As we move down into the thoracic, those ones get a little bit bigger, spinous processes get a little bit longer, and we've got articular facets for ribs. So the thoracic vertebrae are where the ribs attach. And then as we move down into the lumbar region, this is your lower back. These ones don't have rib attachment. They get much bigger at this point, so these are your largest vertebrae. The spinous processes get a little bit shorter and stouter. They're supporting a lot of weight down here. And then at the base, we've got the sacrum and the coccyx. All right. You'll also notice that your spine isn't straight, right? And it's not supposed to be straight. So we've got these curvatures that are built into the spine. So your cervical vertebrae bend or curve anteriorly. So you have an anterior curvature towards the front of the body in your cervical vertebrae. The thoracic vertebrae, those ones curve posteriorly. So here's your little anterior curvature for the cervical, and then we've got a posterior curvature for the thoracic, another anterior curvature for the lumbar, and then this posterior curvature for the sacrum and coccyx. So it's kind of this S shape where it goes in and out. Now, if we look at it head on, it should be straight. It shouldn't go left to right, but it does go front to back. There should be curvature. Right. So here are abnormal curvatures. So the first one there, the picture on the left, is scoliosis. So scoliosis is having an abnormal lateral curvature of the spine. So instead of the spine being straight up and down, it curves to the left or to the right. So that is abnormal. So the spine should be straight up and down. The middle picture there, kyphosis. So kyphosis is kind of a overly curved cervical region where you're kind of, it forms sort of a hunchback because we're curving way too much. And then the lordosis, which is the picture on the right there, this one is common in women who are in the later stages of pregnancy, where if you're carrying a whole bunch of weight, say a whole baby right here, it sort of throws the spine off balance and you get this kind of like a leaning forward sort of walk. And so that's a lordosis, which usually goes away after the baby's born. Okay, so we made it through this next little section here. So what vertebrae are in your lower back and which one is your tailbone? Give you a second. All right, there we go. So your lower back vertebrae are lumbar, your tailbone is your coccyx. All right, where are the atlas and the axis? What are their other names? And what movements do they allow? All right, so the answer is those are your first 2 cervical vertebrae, atlas and axis. Their other names are C1 and C2. So atlas is C1, axis is C2. And then the movement that they allow is rotation of your head. So just the ability to move your head from side to side is because of the way that the atlas and the axis fit together. All right, so we covered the skull, we covered the spine. So now let's just cover the thorax. So we're going to talk about your thoracic cage. which is the ribs that are surrounding your thoracic cavity, and the sternum that kind of holds it all together. Right, so these are bones that are really for protection's sake. So the lungs, the heart, a lot of really important stuff is in your thoracic region, so we need to protect that with a cage, essentially of bone, rib cage. Okay, so we'll start by talking about the sternum. So sternum is the breastbone, right? So this is the bone that's kind of in the front. Let me get my friend here. Right, sternum is right here. So that's the breastbone, or the breastplate that's kind of holding all of these ribs together. If we take this bone, we can actually divide it into a few different segments. So the top part here is called the manubrium, then the body, and then this part here at the bottom, the pointy part at the bottom, is called the xiphoid process. So manubrium, body, xiphoid process at the bottom, right? And now that sternum is going to be connected to a whole bunch of ribs. Not all the ribs directly, but connected to a whole bunch of them nonetheless. And the way it's connected is through costal cartilages. So we can see these cartilages here on this model skeleton. Those costal cartilages are what's attaching the rib to the actual sternum. All right, so there's a better view of the sternum in that picture there. So we can see the top part being the manubrium of the sternum, the main part of the sternum being called the body, and then the pointy part on the bottom called the xiphoid process. All right, so here's a cadaver skeleton, looks like. And here we can still see the sternum with the manubrium, the body, and the xiphoid process. We can see all these costal cartilages that are attaching the ribs, which are over here on the sides, to the sternum, which is in the middle. Okay, so you have a whole mess of ribs, right? You've got 12 pairs of ribs. And the ribs are paired. They don't all directly attach to the sternum and the front of the body. Your first 7 pairs of ribs do. All right, so you've got 7 ribs that are considered true ribs. True ribs means they go all the way around. So they attach from a vertebrae all the way around to a sternum in front. They go all the way. So those are your 7 pairs of true ribs. Right, and then you've got 5 more pairs of ribs. These ones do not connect directly. So these ones are sometimes called false ribs because they don't connect all the way from the back to the front. They all connect to your vertebrae, but they don't all reach all the way around and connect to the front and connect to the sternum. Right, so these are called false ribs. So we can kind of see here, this picture is a little bit small. Let me try to point out what we're looking at here. So if we count through these ribs and we go 1, 2, 3, 4, 5, 6, 7, those are the true ribs. So we can look and see that those guys are attaching all the way to the sternum. Then your next 3 pairs, so ribs 8, 9, and 10. These guys, 8, 9, I'm not doing a great job of the drawing, 8, 9, and 10, those ones do not connect directly to the sternum, but they connect via costal cartilages to the rib directly above them, right? So maybe this guy, you can see. Alter my camera view a little bit here. So we can see if we're looking at ribs 8, 9, or go down 8, 9, and 10, they're attaching via costal cartilages to the rib directly above them. So 8 attaches to rib 7, 9 attaches to 8, and 10 attaches to 9. So they're attaching to the rib directly above them, but they don't connect directly to the sternum. So it's kind of like they would have to kind of travel upward to get into where the sternum is. Right, so those are 8, 9, and 10. I'm going to rotate them around to the back so that you can see his floating ribs. So these are ribs 11 and 12. So ribs 11 and 12. Those guys are called the floating ribs because they don't attach to the front at all, not even via costal cartilages. So they do not attach to the front at all. They're just kind of floating in the back there, hence floating ribs. Okay. So let's talk about which ones of these bones are part of the axial skeleton and part of the appendicular. So if we can remember, axial skeleton is the central axis of your body. Appendicular skeleton is the appendages. So scapula, which is your shoulder blade, clavicle, which is your collarbone, os coxae, which are your hip bones, sacrum, and coccyx. Think about which ones of those are part of the axial versus appendicular. All right, and there's your answer. So the first three, the scapula, which is part of your shoulder, collarbone, which is part of your shoulder girdle, all of that's considered appendicular skeleton. The os coxae, which are your hips, that's considered appendicular as well because that's part of your pelvic girdle. And then the last two there, the sacrum and the coccyx, since those are part of your spine, those are considered axial. All right, a few more questions here. How many pairs of ribs connect directly to the sternum, and what are those ribs called? How many pairs of ribs connect indirectly or not at all to the sternum, and what are those called? And then all 12 pairs of ribs connect to which bones of your body? All right, here's your answers. So your first 7 pairs that connect directly to the sternum are called true ribs. So 7 pairs of true ribs. As far as the next 5, those next 5 pairs are called false ribs. So the first 3 are false, and the last 2, so pairs 11 and 12, are false and floating because they do not connect to the front at all. And then all those ribs, no matter if they're true, false, or floating, are all connected to vertebrae in the back. So they always connect to vertebrae in the back, and it's always the thoracic vertebrae that they connect to. All right, so hopefully this has helped you get a little bit familiar with your learning your bones, particularly the axial skeleton. The next one we'll start talking about appendicular skeleton and get into those bones. Again, let me know if you have any questions. I'm going to keep making these videos. If you've got comments for me on how to improve them, if you can't hear me, I don't know if you guys can see this skeleton guy super well. But as long as I've got access to the lab here, I'll keep coming in and use these models to make videos. I might not always have access. If they start shutting down my access to the building, then I won't be able to come in. But just leave me comments. Let me know what I can do to help. I want you guys to understand this information and feel comfortable with it. All right, catch you guys on the next one.